Do you know that even our eyeball has muscles? It has extraocular muscles which are present outside it and intraocular muscles which are present inside it. The function of extraocular muscle is to move the eyeball. Apart from moving the eyeball, they are also required to maintain the position of the eyeball. For example, what we see in the image here is the abnormal positioning of the eyeball due to paralysis of the muscles of the eyeball. Right? We call this phenomenon as strabismus or squint. So the function of extraocular muscle is to move the eyeball and also to maintain the normal positioning of the eyeball. This is why they are clinically relevant. In this session, let's focus on the detailed anatomy of these extraocular muscles. The learning objectives for this session are: before we get into the extraocular muscles, you should be able to describe what are the boundaries of the orbit. Then, describe the boundaries and structure passing through the superior and inferior orbital fissure. List the contents of the orbit. Classify extraocular muscles and then describe the attachment, innervation and actions of these extraocular muscles. Let's begin with identifying the boundaries of the orbit. As we know, orbits are a pair of pyramidal shaped cavities present on either side of the nose. The orbit on each side has 4 distinct boundaries. Right? Now first let's try to understand what are these. This is the roof of the orbit. This is the floor. Then we have the medial wall. And finally we have the lateral wall. Let's try to understand how exactly these walls are formed. First, let's see about the roof. The roof is formed mainly by the orbital plate of frontal bone. This is the orbital plate of frontal bone. And most posteriorly, we have the sphenoid. Right? So, these are the 2 bones that will form the roof. Orbital plate of frontal bone and the sphenoid bone. When we come to the lateral wall, the lateral wall is mainly formed by this bone. And what is this? This is the zygomatic bone. And again, if you move posteriorly, it is again formed by the sphenoid. Right? Then, what about the floor? The floor is formed mainly by the zygomatic bone again, the orbital process of the zygomatic bone. Then we have the orbital process of the maxilla. And finally, orbital plate of palatine bone. Right? So, there are 3 bones that form the floor. Then comes the medial wall. The medial wall, remember, is formed by 4 important bones. What are they? Here we have the frontal process of maxilla. This is the frontal process of maxilla. Right? Then there is a thin bone referred to as lacrimal bone. That is the lacrimal bone. And more posteriorly we have the body of the sphenoid, body of the ethmoid bone, or you can say orbital plate of ethmoid bone, and even more posterior we have the sphenoid. Right? This is regarding the formation of the boundaries of the orbit. Of these 4 walls, remember the lateral wall is the strongest. It is formed by thick bones and hence it is the strongest wall. Whereas the medial wall is the thinnest of it. So medial wall is the thinnest. Why you need to know this? If fractures of the orbit occur, they are more likely to occur along the medial wall. Right? This is regarding the boundaries of the orbit. Once we have learnt about boundaries of the orbit, let's focus on what exactly is superior orbital fissure and what are the structures passing through it. Now, if you observe this image carefully, the apex of the orbit, that is deep part of the orbit, is showing a V-shaped opening. Right? Now, this is the superior orbital fissure. This is the superior orbital fissure and this is the inferior orbital fissure. First, let's try to focus on the superior orbital fissure. If we draw the outline of the superior orbital fissure, this is how the fissure looks. It is in the shape of a red dot, right? This end is medial, this end is lateral. The entire extent of superior orbital fissure is formed by above the lesser wing of the sphenoid and below by the greater wing of the sphenoid, right? So what we have here, this is the lesser wing, that's the lesser wing, and what we have here, this is the greater wing. So the boundaries of the superior orbital fissure are easy to remember. Above it is the lesser wing of the sphenoid and below it is the greater wing of the sphenoid. The entire outline of the superior orbital fissure is divided into 3 compartments, and this is by a fibrocartilaginous ring. This ring is known as the tendinous, it is known as the tendinous ring of Zinn, right? It is called as tendinous ring of Zinn. This gives attachment to the medial rectus muscle. This is the medial rectus. Here we have the lateral rectus. Then here we have the superior rectus. And here there is inferior rectus. The entire superior orbital fissure is divided into 3 compartments. This is known as the superolateral compartment. Then we have an intermediate compartment, and then we have an inferomedial compartment. Each compartment will allow for passage of important structures. Now let's try to understand what are these structures. First, there are 3 important nerves. Now these can be remembered by the mnemonic L, F, T. LFT stands for liver function test. But here LFT stands for lacrimal nerve, frontal nerve and trochlear nerve. Right? Along with this, there is a vein. This is the superior ophthalmic vein. And there is an artery. This is the recurrent branch of ophthalmic artery. Recurrent meningeal branch of ophthalmic artery. So these are the 5 structures that pass through the superolateral compartment. Then what about the intermediate compartment? Intermediate compartment will allow for passage of one important cranial nerve which has 2 divisions. What are this? These are the superior and inferior ramus of oculomotor nerve. Right? Superior and inferior ramus of oculomotor. Then there are 2 more nerves. What are these nerves? This is the 6th cranial nerve or abducent nerve, right? And then this nerve is the nasociliary nerve. This is the nasociliary nerve. So there are 4 nerves passing through the intermediate compartment. Then the inferomedial compartment will allow for passage of one vein, and we call this as inferior ophthalmic vein. Right? This is referred to as inferior ophthalmic vein. So this is regarding the structures passing through superior orbital fissure. A very important topic both for your theory exam as well as entrance exam. The structures passing through each compartment has been asked plenty of times in your entrance exam. Right? This is regarding the detailed anatomy of superior orbital fissure. Once we have learned this, let's focus on the anatomy of inferior orbital fissure. As we have already identified, this is the inferior orbital fissure. Now how inferior orbital fissure will look? It will look like this. Right? This is the inferior orbital fissure, and inferior orbital fissure, as we can see, is bounded above and below by 2 important bones. Now above it is by the greater wing of sphenoid. Greater wing of sphenoid, whereas below it is by the body of maxilla or maxillary bone. What important structures pass through this? Now remember, this will allow for passage of zygomatic nerve. This is the zygomatic nerve. Then we have a nerve and a vessel. These are the infraorbital infraorbital vessels and nerves. Right? Then it gives passage for one more important nerve. This is referred to as the orbital branch of pterygopalatine ganglion. You can simply remember it from the first letter of this as ZO. The structures passing through the inferior orbital fissure. Even though this is also important, more important will be to know the boundaries, subdivisions and structures passing through the superior orbital fissure. Right? This is regarding the inferior orbital fissure anatomy. Once we have learnt about the boundaries of the orbit, the superior orbital fissure and inferior orbital fissure, let's try to list what are the structures that are present in the orbit, the contents of the orbit. Right? What is the most important content of the orbit? We all know that the most important content would be the eyeball. Right? So the most important content is what? Eyeball. Now eyeball needs some kind of cushioning, right? It cannot lie freely within the orbit. So what we have? We have the orbital fat, which will act as a cushion and protect the eyeball. The eyeball is located in a facial sheath. We call this as the orbital fascia. Right? The eyeball to move needs muscles. So what are there? We have extraocular muscles. We have extraocular muscles. If muscles are there, they have to be controlled by nerves. So we have the nerves of the orbit. And what nerves of the orbit? All the nerves that come out through the superior orbital fissure can be listed here. What are they? We have the third cranial nerve, we have the fourth cranial nerve, the sixth cranial nerve, and then the nasociliary nerve, branch from the ophthalmic division of trigeminal nerve. Right? Then the extraocular muscles not only need innervation, but they will also need arterial supply. So what we will have? We will